Florida got its first shipments of the coronavirus vaccine there this week, and officials are calling it 20,000 doses of hope. Dr. Jason Wilson is the Associate Medical Director at Tampa General Hospital, one of the great hospitals in the state of Florida, and is one of thousands of healthcare workers who has gotten the first dose of this Pfizer vaccine. Dr. Wilson, report. First question, how are you feeling?
Hey, I'm feeling okay. I was fortunate to receive the vaccine on Tuesday afternoon. We're 48 hours out now. Yesterday felt a little bit like I got maybe hit by a slow speed pitch or maybe punched in the arm on the right side here. I'm left-handed, so I get my vaccines on the right side. But today I've got really no symptoms at all. Exercised this morning and feeling great.
By the way, I did not know that. You're supposed to get the vaccine on the opposite hand. So if you're right-handed, you get it on the left?
I don't know if there's a specific rule, but it's always a good idea in general, I think, because you probably have some soreness the next day. So just,
right.
to not have any effect of your dominant hand. It's always a reasonable idea with the shot in general.
I didn't know that. That's interesting. Makes sense, though. There's been a lot of controversy since the start of the pandemic over how COVID deaths are classified. When the pandemic first started, everybody was just dying of coronavirus. That's it. Now there are comorbidities, and we found out that the people that are dying are either elderly, like 80 plus, or have one or multiple comorbidities. What's the policy at Tampa General right now, and what do you think that standard should be nationwide?
Sure. What we do know is that COVID has resulted in many, many deaths in this country, hundreds of thousands of deaths in this country. And, the clinical reality of what I see is able to sort of test and make transparent all the debates about data that we might have out there. And one thing we do know is that in Florida, every time we've seen an increase in the number of testing, an increase in the number of tests, what's followed from that is an increase in hospitalizations and then an increase in deaths as well. Now, in Florida in general, we've done very good with deaths. They're very, very low overall. But our hospitalizations remain pretty high, not as high as June and July, but we're seeing another little surge right now. So however you slice the numbers, we know that lots of people are affected by this virus. Report out from JAMA yesterday, a little sobering as well. For the most part, we think about young people doing pretty well. And overall, that is true. This virus obviously has a much greater impact on the elderly. But over 12,000 extra deaths can be attributed to people between 20 and 40 years old now compared to last year, likely because of coronavirus.
It's interesting. So what's happened now, 9 months into this awful pandemic, is the death numbers, the death per 1 million population, have almost lined up exactly with the state's respective populations. California, Texas, Florida, New York are all among the top states in fatalities and cases, but they are also in the top five in population in this country, with California, Texas, and Florida being 1, 2, 3. And New York is number 4. Do you think that this virus does better or is more or less successful in warmer climates?
Yeah, we haven't really seen, we'd hoped during the spring that we would see some kind of difference as we go into the climates. Now, one thing in Florida we do wonder about is the ability to stay outdoors for a longer period of time. I'm still going to eat outside today. It's going to be 80 degrees and it's beautiful and sunny here compared to New York City and DC or wherever else. And we do think that's probably keeping our numbers down, even as the state has largely reopened compared to other places that have undergone reopening. Our numbers are lower compared to those places, likely because we're able to stay outdoors and social distance when we are outdoors.
Yeah, and I know there's that stale air concept where in Florida the numbers started going up over the summer because it was so hot that people would go inside where the air conditioning is running, much like up north when it gets cold. People are inside where the heat is on, and we've seen spikes in cases. Are you encouraging your patients to get the vaccine?
Oh, absolutely. So I encourage everyone when it is time for them and they are eligible to get the vaccine, they should get the vaccine. This is a moon landing level scientific breakthrough that we're witnessing right now. This is our best chance to get out of this pandemic and get ourselves back to a normal life and get our economy running again and get our healthcare systems running again and, get people to be safe. And what we've seen so far from the both Pfizer data and now the Moderna data that was released a couple of days ago, these look to be very safe and extremely efficacious vaccines. Obviously, we should keep on following the downstream safety. This is, still a new vaccine, but what we're seeing so far is pretty amazing, both safety and efficacy data.
All right, Dr. Jason Wilson, good stuff as always. Thank you from Tampa General. We appreciate it.
Sure.